Here's what's coming up on your horizon. Well, in my memory, never before has a new law been met with more derision than the Affordable Care Act or Obamacare. Yet, here we are. It is the law of the land, despite such bitter opposition. Today, we begin our show by looking at how we got here and where the new health care reform law is taking us. I'll take you inside an emergency room to look at the effects it could have on rural Oklahoma. And we end our day with a conversation about how to navigate the intricacies of the new law. So you need to stay with us for Oklahoma Horizon.
Oklahoma Horizon is made possible by the Oklahoma Department of Career and Technology Education.
Oklahoma's investment in career tech provides more than nationally recognized technology education and training. It produces solid financial returns for the state's economic future. Oklahoma Career Tech, elevating our economy.
And the Oklahoma Department of Agriculture, Food, and Forestry, helping good people grow good things. And now, from the Career Tech Studios in Stillwater, here's your host, Rob McClendon.
Hello, everyone. Thanks for joining us here on Horizon. Well, amid all the sound and fury that is today's politics, the sign-up for the Affordable Care Act is now well underway. For many of us, almost half of all Americans, little changes. Our employer-provided insurance stays the same. But for Americans without health insurance, or for those whose plans were unaffordable, they now have other options. Whether or not this bankrupts the nation or proves to be a vast improvement is yet to be determined. Today, we're going to focus on not only how we got here, but where we are going when it comes to health care in this country. And that is where our Andy Barth picks up the story.
Rob, here are some dates I want you to consider when we're talking about the state's health care and the Affordable Care Act. Now, we're going to be working backwards in time. The first date we want to look at is January 1st of 2015. Now, this is the date where large employers are mandated to provide health insurance for employees or face a penalty. Now, the next date is March 31st of 2014. This is when open enrollment in the exchanges closes. This is also the date when individuals who do not have insurance may face a penalty of $95 or 1% of their annual income, whichever is higher. Now, January 1st of 2014 is when coverage begins for the plans purchased through the exchange, and the most pertinent date right now is October 1st of 2013. This is when Insurance Exchange began and provides the online ability for consumers to apply for individual health coverage and compare rates. And while sign-up is underway, many questions are left unanswered. It's landmark legislation
Substance.
that, despite lawsuits and multiple attempts in Congress to repeal it,
This law is a train wreck.
is now the nation's law.
If you're one of the 85% of Americans who already have insurance, you've already got new benefits and protections under this law that you didn't have before.
According to the Census Bureau, there are more than 685,000 Oklahomans with no health insurance. And under the Affordable Care Act, 370,000 of them will be eligible for federal tax credits to help them pay for coverage. That's 9% of the state's population. Stan Hupfeld is the former CEO of Integris Health and says this statistic impacts all policyholders financially.
The uninsured do impact what you're paying. They do impact what you're paying in premiums. They do impact what you're paying every time you go to the hospital. Because in the past and currently, there's hundreds of thousands of people in Oklahoma who do not have insurance, who eventually show up in hospital emergency rooms, for which policyholders ultimately pay their bill.
Which is what the Affordable Care Act is designed to remedy. Yet questions still abound.
My question is from my granddaughter. She works 30 hours a week, makes $9 an hour.
At a forum sponsored by Oklahoma Watch, most concerns centered on the confusion surrounding the new law.
Basically, you guys are telling us that this is going to be available, but you don't really know for sure exactly what is going to be available.
This really is just about creating an option for people who don't have insurance.
Andrew Rice is a former Oklahoma State Senator and current Executive Director for the Variety Care Foundation, and says it's important to know the facts.
I think the most important thing for someone who's uninsured is to try to get in front of one of the healthcare navigators.
As of now, 36 states are participating in the federal government-run exchanges. Oklahoma, not one of them, but there are some options for state residents. There are 5 companies offering private health coverage in Oklahoma under the Affordable Care Act: Blue Cross Blue Shield of Oklahoma, Community Care, Global Health, Coventry Health, and Aetna. Now, of the 4 out of every 10 Oklahomans who already receive health insurance from their employers, they don't have to change plans, but Rice says they may want to check their options.
I would encourage everybody to shop on the exchanges. It's a competitive marketplace where these different insurance companies are competing to have better plans. It's great for everybody to shop and try to find a better deal.
Changes that affect not only employees, but employers as well. Come January 1st of 2014, all employers with more than 50 employees will be required to offer health coverage, while those with fewer than 50 remain exempt. And Sandy Montgomery says she has clients who need answers.
I work for a CPA's office in Yukon, and we have a lot of small businesses that we do taxes for, and they are calling me and asking me how this is going to affect them.
I'm concerned.
And Montgomery says right now there are more questions than answers.
I need to tell them which of these employers are going to be required to have handouts available to their employees. I know anybody that's subject to the FLSA is required to have the handouts available. And also anybody with more than 50 employers has to have the shared responsibility or provide health insurance. Most of the customers that I have are going to have less than 50 employees, and so it's going to be just the handout thing that I'm interested in.
Now, while most everyone will be required to have health insurance by March 31st of 2014, some qualify for federal tax credits to help them pay for it. And it's all based off the federal poverty level.
Generally, it's a set amount. So the federal poverty level is $11,000 for a single person. It's higher for a family of 2, higher for a family of 3, higher for a family of 4. 100% of that, so 1 times that, so $22,000 for an individual would be 100% of the federal poverty level. From 100% to 400%, there are going to be tax credits available for people to help them pay for the premiums that they have on health plans on the exchange.
The periphery.
And for those people already on plans with limited coverage, those will be changing too. Under the Affordable Care Act, everything from emergency services to prescription drugs are covered. Under the new law, private providers must meet the same standards.
I firmly believe that the law over time there will be kinks that need to be worked out. There'll be unintended things that are difficult about it that I trust Congress and future administrations to resolve and fix. But I think on par, the law is going to create a lot more access for people. And I do believe the economics behind it are going to bring costs down. The more people who are covered, costs will come down. A lot of the costs in healthcare are compensation for people who don't have insurance, who get very sick.
Hopefully creating a buyer's market when it comes to health coverage. Now, while this law is not considered government mandated, those who don't purchase health insurance by March 31st of 2014 are subject to a $95 fine, which will rise to $695 by the year 2016.
So let me play devil's advocate here. What keeps a person from paying those fines, which are quite a bit less than the premiums, and then only entering into the system when and if they need care?
Certainly. Well, open enrollment continues until March of 2014, so people can take their time when trying to find their insurance. But those who choose not to purchase it not only face those IRS fines, but they also face those out-of-pocket medical expenses as well.
Yeah, and the unfortunate fact is you need more healthy people in the pool than you do sick, or the math just doesn't work.
That's right, Robin. In great part, that means people my age who also at the same time faced the highest unemployment rates when when our economy took a downturn and cut out vast segments of jobs.
Now, one last question. In your piece, you said there's going to be a gap between those people eligible for Medicaid and those people that are going to get the tax credits for the ACA to help them pay for their premiums.
That's right, and unfortunately that means some of the poorest people here in Oklahoma. Now, like many other states in the nation, Oklahoma refused the federal government expansion of Medicaid, and so that means that our very poorest people will not be able to apply for the federal tax credits to help them pay for the insurance, and very well could go uninsured.
Sounds kind of unfair.
It does sound unfair, but if there's a small silver lining to that dark cloud, those who are unable to afford the health coverage because they're in that low income bracket, they will not be fined for not having health coverage.
All right, thank you so much, Andy. Now, if you'd like more information about the Affordable Care Act, just head to our website's Value Added section at okhorizon.com. There, we have a link to an infographic of the potential penalties if you choose to go uninsured. And also have our full interview with Stan Hupfield, the former Integris Hospital CEO and the author of the book, Political Malpractice. Now, when we return, a look into some of the bigger issues surrounding healthcare with an Oklahoman with a very unique perspective.
You're watching Oklahoma Horizon, featuring some of the good things that are happening in the great state of Oklahoma.
Well, it is the working poor who often suffer the most from the lack of health insurance, and few people have seen exactly how that plays out any more than the Oklahoman in our next story. Doug Cox is an emergency room physician as well as a Republican state senator, and it is those two roles that has put the good doctor at odds with his own party when it comes to our state's approach to federal health care reform.
Pro VR, go ahead.
When accidents happen and minutes matter, access to emergency health care can be the difference between life and death. Inside these doors at the Integris Hospital in Grove, Oklahoma, emergency room physician Doug Cox has seen it all.
You know, I've seen a dramatic change. First of all, there's been a huge increase in volume. Secondly, primarily we used to see emergencies, things such as strokes, heart attacks, cuts that needed to be sewn up, sutured, broken bones. It was truly an emergency room.
So you got T-boned?
Now probably 90% of what we see in the emergency room is not a true emergency. It's everything from a toothache to a common cold, 90% of which could be handled in a private physician's office, a family medicine or an internal medicine's office.
Why do you think that is?
Well, I think there's two reasons, and that's what kind of keeps me grounded working in the ER. We deal with real life and real life situations, and we see people in the emergency room who have a primary care physician. They've tried to get into that doctor's office, but they say, well, our first opening is in 3 weeks. I think that's an indication of the physician shortage in Oklahoma. It's statewide, it's nationwide, but it's a little bit worse in Oklahoma than it is in most states, and it's worse in rural areas such as Delaware County, Grove, Jay, my surrounding area.
Increasingly, family practices in rural Oklahoma are getting fewer and further apart. And with 1 in 5 Oklahomans currently without health insurance, emergency rooms like Cox's are often their only option.
Now, one thing about the emergency room is we treat all comers. To me, it's comforting, it's reassuring, it's what America is about, to know that regardless of your socioeconomic status, you're going to get the same great care in this emergency room, whether you're a millionaire or a pauper. Unfortunately, the mindset of many people is that it's only the slackers, the people who are too lazy to work, that need help and don't have insurance. The reality of it that we see every day here in the emergency room, it's people who work, but they have lower paid jobs and they work for companies that are small, and the companies can't afford to provide health care. The cost for a company to provide a family insurance policy is right about $15,000 a year for them to provide insurance for their employee and their family. Many small companies can't afford that. So contrary to popular belief, it is hardworking, tax-paying Oklahomans that can't afford health care insurance. Unfortunately, I see it every day here. A couple of things. Number one, someone may come in here and they've gone to a physician, got treatment, got an appropriate medication, can't afford to buy the medicine. They don't have insurance to help them with their pharmacy bill. So it's a tough situation.
And oftentimes may find themselves right back in here for expensive care?
That's true, and the emergency room is the most expensive place to get care, and I may surprise you by saying this, but as an ER physician, I know it's not the best place to get care for chronic problems such as high blood pressure, emphysema, because if you come in here 10 times, you may see 10 different emergency room physicians. There's just no continuity of care. Take some deep breaths for me.
And it's that lack of continuity that often can lessen healthcare outcomes while increasing healthcare costs.
continuity of care and having what we call a medical home, a primary care doctor, has been shown to improve quality, because you know that doctor, he knows you, he gets to know not only you as a person, but you and your diseases and your family situation, and is just able to provide better, more comprehensive care.
And Cox worries Oklahoma's reluctance to fully take part in the Affordable Care Act, or ACA, could make the current doctor shortage in rural Oklahoma even worse. That's because the ACA is funded in part by a cut in Medicare reimbursement dollars that goes to hospitals and physicians.
Well, if we continue to experience the lower reimbursement that's designed to help pay for the ACA without experiencing the increase in payments by the Medicaid expansion, we certainly can't afford it. It's going to put a crimp in already cash-strapped, particularly rural hospitals.
So is it fair to say that in this instance, the rhetoric and the heat of the politics has maybe gotten in the way?
Well, I think so. I mean, especially the argument of, hey, we don't want to take any of those nasty federal dollars. Well, look around. We took them for disaster aid, as we should have. We take them for roads and bridges. We take them for education. If you look at our state budget, a huge chunk of it is made up by federal matching dollars. Those are a return of our dollars that we as hardworking Oklahomans send to the federal government in the form of federal taxes. The program is set up for us to reap some of the benefits of those by returning to Oklahoma, and yet the political rhetoric has tended to put blinders on people when it comes to health care.
Yeah, and so maybe we're just not being honest with ourselves, whether it be at the Capitol or on Main Street.
Well, I think that's true. And you know, that's one of the things that working in the ER keeps me grounded. I deal with real life situations here. And people who come in here, they're more worried about their ability to, if not get good care for them, they want to make sure their children get good care.
And it is Oklahoma's youth that Cox and others believe may offer the best solution to Oklahoma's rural doctor shortage.
The quicker you expose a young person to the career of medicine and how rewarding it can be, the more likely they are to go into it. I think it's important to start talking to kids in junior high school about the rewards of a medical or science career.
We could talk about ethics all day long.
That's why at Coweta High School, FFA students are learning about more than agriculture. Bailey Diffie is among the first FFA students in Oklahoma, recruited while still in high school to consider a career as a rural physician.
I've always wanted to be in the medical field, but I never knew what I wanted to do. And then talking to Dr. Schrum helped me out a lot.
Dr. Casey Schrum is the Dean and Provost at the Center for Health Sciences at OSU Tulsa.
We have to look at doing things differently than what we've done in the past. Medical schools have typically, reached out to college students and encouraged college students.
And to reduce the shortages, OSU is teaming with FFA to encourage rural high school students to become doctors dedicated to practicing medicine in Oklahoma's smallest communities.
Page 9, where we ended up Friday.
According to the federal government, all but 5 of the state's 77 counties are experiencing a doctor shortage, with 30 of Oklahoma's counties having 10 or fewer doctors of any type.
Well, first of all, we need to train more physicians, and this is not something that we can do quickly, because if we were to double the size of the medical schools today, it's actually 7 years before that first physician can open up an office or go into practice. It takes a minimum of 7 years to train a physician, so it's not something we can change overnight.
Just over 1,000 students are enrolled in Oklahoma's 2 university-run and state-funded medical schools.
Herniation.
Med students who, upon graduation, will then apply for a 3 to 7 year residency, depending upon their chosen specialization.
We know that most physicians will stay within 100 miles of where they do a residency program. So we have to fund residency programs in this state. It does no good to train more medical students if we don't have the residencies to keep them in this state.
A competition that also exists between urban and rural settings. That's why the Oklahoma legislature established a fund to create residency programs in rural areas.
Durant, Enid, and Tahlequah are established, and we're trying to get Lawton started up for Western Oklahoma.
For the first 2 years of medical school, doctors like Charity Holder live and train in Tulsa at the OSU Health Sciences Center.
But now I'm thinking that it's more likely related to the incision.
But for the next 5 years, they train in rural hospitals. Dr. Holder says the program gives participants more hands-on experience than a typical big city training hospital would.
I talked to some of my colleagues up at OSU, and they said that on their OB month, they only got to deliver 2 babies, and they technically didn't get to deliver them, they just assisted. Well, my classmates and I that went down to Durant and Amanda Reed and Tahlequah, our comparison charts, we were delivering 30 babies a month. You know, we were catching them. We actually got to do all the procedures. We were first assist, whereas third-year residents didn't get to be an assist. We got to first assist on all these really awesome procedures. We were in surgeries all the time.
And when Holder finishes her residency, she plans to practice in her hometown of Colgate.
It's one of the things that the Affordable Care Act does. It values primary care, family medicine, and creates a little higher reimbursement for those primary care specialties to encourage more people to get out where the rubber meets the road in taking care of people in areas where they first become sick and enter the medical system.
Any fever chills?
No.
But most believe the success of healthcare reform will ultimately be determined not by doctors, insurance companies, or even Washington, but by patients. Healthier habits don't take an act of Congress. 19% of us still smoke. A third of Americans are obese, and another third are overweight. It's controllable diseases like diabetes, heart attacks, high blood pressure that are the real killers and propel healthcare costs into the stratosphere. And it's controlling those costs that will ultimately make the real difference. Want to share something you've seen here today? Well, all of our episodes are streaming on our YouTube channel at Oklahoma Horizon TV. Or you can subscribe to our weekly free podcasts on iTunes. Well, when it comes to the new healthcare law, everything from availability to affordability can get pretty confusing, which is why the Oklahoma Primary Care Association is working with groups around the state to help cut through all the clutter. Joining me now is the OKPCA Interim Director, Judy Grant. Judy, thank you so much for being here.
Thank you.
For of these people that do not have insurance, what are some of the various plans that are available to them?
The plans are all listed for the Oklahoma Marketplace through healthcare.gov. If you go to the website, they're listed there. They are categorized according to medal levels, the gold, silver, and bronze, and then some catastrophic and some youth dental programs are on there. And you would just need to go to that website to really look at what is available through the Oklahoma Marketplace.
If you were counseling someone who was getting insurance for the first time, and they do fall in that 100 to 400% of the federal poverty level, and they tell you, I just can't afford it, what are their options?
Now, if you choose not to participate in this program at all, there are penalties. One article I was reading yesterday suggested that the penalties were not steep enough for some people. They would just go ahead and take the penalties. Of course, that's not the idea behind it. We really want people to understand that it goes so far beyond just the cost of the premiums. It's what you're trying to prevent, and that's financial ruin if you do face a catastrophic event. If you do get into a situation where your health demands care that exceeds far what you could possibly ever afford, and then you find yourself into some kind of situation where you're forced to file bankruptcy. That's what we're trying to get folks to understand. Please look beyond the premium. Understand that you do need to make an investment in your health. It is very important. I think that a lot of people don't understand the necessity of planning for health care in your budget, just like you would anything else that is for the good of you and your family. When you think of healthcare, you can't isolate it to just the individual. It is important for the state of Oklahoma to have a healthy workforce, to have people that are highly functioning, that show up for work, that do what they need to do to be a productive citizen. And so if you think of it in terms of just the individual, you're missing the bigger picture of what it does for the state of Oklahoma.
Well, Judy, I certainly appreciate the conversation and the insights, and hopefully you can come back in a year and we will know a lot more about this.
Thank you so much for having me. I appreciate the opportunity to talk about health.
All right. Thank you, Judy. And we will continue our conversation with Judy on our website. Just go to okhorizon.com. Oklahoma is transforming the heartland into a global crossroads. Next time on Oklahoma Horizon, we examine why our businesses are booming in areas you may not realize. Plus, we'll get a little red dirt on us as we look at how this homegrown music style is driving a state of creativity. On Oklahoma Show for the Heartland, Oklahoma Horizon. Well, we are out of time. I'm Rob McClendon. Thanks for watching. See you back here next week.
Horizon is made possible by the Oklahoma Department of Career and Technology Education and the Oklahoma Department of Agriculture, Food, and Forestry. Thank you for watching Oklahoma Horizon.